Bismillahirrahmanirrahim. Assalamu alaikum everyone. So this is my favorite topic, and our episode number 4, arrhythmias, and this is a part of our serious lecture series. So let's start with it. So this is a little lengthy chapter and very informative and very focused chapter, which requires more focus. So what is arrhythmias? Normal sinus rhythm, it's about 60 to 100 BPM. Normal heart rate is about 60 to 100. Frequency of depolarized ventricles. Diagnosis: ECG is the best. Arrhythmia: irregular heartbeat caused by dysfunction of electrical impulses of our heart muscles, which can be a bradyarrhythmia, which can be a tachyarrhythmia, or which can be a supraventricular arrhythmia. If the heart rate is too slow, we count as a brady. If the heart rate is too fast, we count as a tachy. Or if the supraventricular arrhythmia, which could be a tachycardia, AFib, atrial flutter, PSVT. Atrial fibrillation is most common, mostly rapid ventricular response, less blood in atria, hypertension, blood clots, and brain stroke. So this is a mechanism. Most people are unaware about this. So, okay, it could be a ventricular arrhythmia. So if a ventricular tachycardia, ventricular fibrinolysis, premature ventricular contraction, which is called PVC, ventricular tachycardia, VT, which heart rate is 100, less than 100, due to series of PVCs, premature ventricular contraction in a row. B. Ventricular fibrillation, medical emergency due to untreated ventricular tachycardia. If your ventricular tachycardia is not treated, then it can lead to medical emergency, which is called ventricular fibrillation. If ventricular fibrillation can lead to an emergency condition if untreated. So first, tachycardia or trachyarrhythmias, then fibrillation, then flutter, which is a very serious condition. Sign and symptom: palpitation, dizziness, lightheadedness, like it's about a headache and very like tight-headedness. SOB, chest pain, shortness of breath, fatigue. Most patients are symptomatic, but some can be silent, only detected with physical examination. Cause: most common cause is myocardial infarction, but also cardiac damage, valve disorder, hypertension, heart failure. Electrolyte imbalance like potassium, magnesium, sodium, calcium. Elevated sympathetic state. That's why the range of drugs involved in arrhythmias, which is due to their cause. If the cause is MI or hypertension or heart failure, then choice of drug is according to them. So these are classes in arrhythmias we are talking about. So it's also the class which correct the electrolyte imbalance. Elevated sympathetic state like hyperthyroidism, infection, cardiac infection, drugs or alix drugs. Cardiac action potential. So this is very this topic is hard to define, like by talking it's about learning. So I know you already knew about this phase. Just brief it. Phase 0, a rapid ventricular depolarization, initiate heartbeat due to sodium influx, QRS complex. Phase 1, early rapid repolarization, sodium channel close. Phase 2, plateau in response to calcium influx and potassium efflux. Phase 3, rapid ventricular repolarization in response to potassium efflux or T wave generate. Phase 4, resting membrane potential. which is called RNP, arterial depolarization, which make P wave. Let's talk about QT prolongation. QT prolongation 440 ms more than dose dependent or addictive when drug induced. Potassium, magnesium ion decrease increase the risk. Torsade the points. Prolongation of QT interval that may lead to cardiac death. Okay, so key QT's prolongation causing drugs. Anti-arrhythmia class 1, azoles, antidepressant, sertraline preferred, antiemetic 5-HT3, antipsychotic, FQs, droperidol, phenothiazine, donepezil, methadone. Other drug may cause foscarnet, telmensin, chemo like NIBs and MIBs, and HIV drugs, NIVIRs, Relpivirin. Now let's talk about Vaughan-Williams classification of AED. Class 1, Class 2, Class 3, Class 4. Class 1 is 1A, 1B, 1C. The drugs include is 1A is disopyramide, quinidine, procainamide, 1B is lidocaine, mexiletine, 1C is flecainide, propafenone. All cause QT prolongation, all especially class 1C have BBW for patient recent post-MI. Recent or post-MI for both. Class 2 beta blockers indirectly block calcium channels, slow ventricular rate. Class 3 dronidiron, dofetilide, sotalol, ibutylide, amidron, block potassium channel, all have addictive QT prolong. Caution with negative inotropes, beta blocker or known DHP calcium channel blocker. Electrolyte imbalance must be corrected. Avoid grapefruit juice. Ephedra, St. John wort, these are the herbs. Decrease digoxin dose by 50%. Warfarin dose 30 to 50% decrease. So if you are taking these drugs, you need caution. Class 4 known DHP calcium channel blocker, which include verapamil, diltiazem. Memory tool DQP double quarter pounder LM lettuce plus mayo FP fries please, because DDSI dieting drug stress is always VD is very difficult. So you can read is double quarter pounder lettuce plus mayo fries please, because dieting during stress is always very difficult. So DQP is disopyramide, quinidine, procainamide. LM is lettuce plus mayo is lidocaine, mexiletine. Fries please, because fries is flecainamide and please is propafenone, and because is beta blocker, and dieting during stress is always DDSI, dronidron, dofetilide, sotalol, ibutylide, amidron, and VD is verapamil and diltiazem is very difficult. So you can remember it double quarter pounder lettuce plus mayo fries, because dieting during stress is always very difficult. Let's talk about treatment goal. Asymptomatic goal at heart rate and symptomatic goal heart rate. 80 approx and 110. If asymptomatic, then 80 is your goal. If symptomatic condition, then 110. And beta blocker paper or known DHP CCBs for arterial fibrillation patient. For known DHNP and calcium channel blocker for arterial fibrillation, otherwise beta blocker is preferred. Digoxin may be added for refractory patient or who cannot take beta blockers and calcium channel blocker. Known calcium channel DHP calcium channel do not give if patient have heart failure or ejection fraction. required stroke prophylaxis for life based on CHAD SVA score, QAC or ESA. Rhythm control. Goal is to restore or maintain NSR. Use class 1A, 1C or class 3 medicine or electrical cardioversion. Amidron is the last option due to toxicity and heart failure which can lead to. So amidron is last choice. Prior to taking any meds for arrhythmia, electrolytes check plus toxicology screen should be done. This is very important note. Let's get complete knowledge about medicine. Disopyramide, the brand name is available as Norpace. Mechanism of action class 1A, which include disopyramide, quinidine, procainamide. Sodium blockers, pro-arrhythmiatic, negative inotropy, strong anticholinergic effects, all cause QT prolonged. So as ADR's anticholinergic effects, hypertension, diarrhea, stomach cramping, synchronism. Okay, disopyramide cause anticholinergic effect, quinidine cause diarrhea, stomach cramping, synchronism, ear, eyes, headache, delirium, envy, rash. Procainamide lead to hypertension and rash. Um, in warning is disopyramide, pro-arrhythmiatic heart fail, BBH is benign prostrate hyperplasia. Quinidine may increase mortality in atrial fibrillation or atrial flutter, so you are not using it. Drug-induced lupus can lead to DIE, and quinidine is also included in DIE. Hemolysis in G6PD patient, procainamide and procainamide is fatal blood dyscliasis, which is agranulocytosis, and is also can cause DIE. So quinidine and procainamide cause DIE. Contraindication: disopyramide second and third block, heart block contraindicated, cardiogenic shock में contra and indicated है, congenital QT syndrome में नहीं देंगे, 6 syndrome में नहीं देंगे. Quinidine use accuse ritonavir second और third heart block में नहीं देंगे, thrombocytopenia में नहीं देंगे, myasthenia gravis में quinidine नहीं दी जाएगी. Procainamide second and third heart block, SLE और TDP पे नहीं दी जाएगी. Note: Quinidine avoid changes in electrolyte intake. Take with food. Procainamide is N-acetyl procainamide. NAPA is the active metabolite. Okay, let's talk about class 1B, which is sodium blocker, sodium channel blocker, and only used for ventricular arrhythmias. Class 1A is sodium channel blocker, but for pro-arrhythmiatic and negative inotropy. Class 1B sodium channel blocker only used for ventricular arrhythmia, cross blood-brain barrier, and cause CNS symptoms. So lidocaine and mexilatine. Lidocaine is available as xylocaine. So ADRs is NV, dizziness, CNX, tremor in coordination. Hepatotoxicity is due to mexilatine. Contraindication: lidocaine in second and third heart block, wall Parkinson, allergy to corn. You are not using this lidocaine. If you have using mexilatine, second and third heart block, cardiogenic shock, blood dyscliasis, serious skin rash or distress can occur. So let's talk about class 1C, which is also a sodium channel blocker. Propafenone has beta blockers. जो प्रोपाफेनॉन है वो बीटा ब्लॉकर है, अदरवाइज ये 1C में ही आ रही है क्योंकि ये सोडियम चैनल ब्लॉकर है. ओके, प्रोपाफेनॉन इज रिथमॉल के नाम से अवेलेबल है. ADRs dizziness, visual disturbance, dyspnea. Okay, they both having same. And propafenol, another ADR is a metallic taste, which is very important. If you remind it, the propafenol is a metallic taste. So it can be MCQs. Warning is pro-arrhythmia. Pelacon is used in not used in pro-arrhythmiatic condition. Okay, contraindication: heart fail, LV, hypertrophy, नहीं लेफ्ट वेंट्रिकल हाइपरट्रॉफी नहीं यूज करेंगे. रिसेंट MI है, आप यूज नहीं करेंगे. Okay, so mix what the drug is propafenone. Most increase in mortality with BBW. If the condition is BBW, it can increase the mortality rate. So talk about class 3, Class 3 is calcium channel blocker. It include amidron, which is available in Nextron, and Pasiron. Okay, how they act. Mechanism of action is additive QT prolongation, caution with increase, degree negative inotropes, correct electrolyte imbalance, do not use in grapefruit juice. Ephedra and excision woods भी आपने use नहीं करने. ADRs, hypertension, bradycardia, corneal microdeposit, dizziness, ataxia, tremor, die. Okay, warning, proarrhythmia, pulmonary hepatotoxicity, contraindication in 6-sinus syndrome, second and third heart block, bradycardia, cardiogenic shock, कलिफिशन में use नहीं करेंगे. So mostly drugs used in arrhythmiatic condition. Notes. Must decrease dose of digoxin 50% डिक्रीज करनी है क्योंकि टॉक्सिसिटी हो सकती है. वारफेरिन की 30 to 50% डिक्रीज करनी है बिकॉज टॉक्सिसिटी हो सकती है. फोटो सेंसिटिविटी होती है. अवॉइड ग्रेपफ्रूट एंड इन पेशेंट विथ हार्ट फेलियर में यूज़ नहीं करनी. इन्फ्यूजन, अगर इन्फ्यूजन जो है वो 2 आवर ज़्यादा है इससे कम में देनी है. मस्ट बी गिवन इन नॉन पॉलीविनाइल पीवीसी कंटेनर सच एज पोलियोलिफिन और ग्लास में आपने देनी है, पीवीसी कंटेनर में नहीं देनी. तो ये ग्लास में देनी है. व्हाट एमिड्रॉन प्री मिक्स नेक्स्ट्रॉन कम्स इन गैलेक्सी कंटेनर नॉन पीवीसी. द रीज़न ये होता है कि कुछ ड्रग जो है वो जो प्लास्टिक होता है उनके साथ जो है इंटरेक्शन करती है, तो इस वजह से हमें उसे ग्लास में देनी चाहिए ताकि वो इंटरेक्शन ना करे. नॉन पीवीसी प्लस नॉन DEHP mix pre-mix with IV bag, stable longer. Okay, okay. Slow the effusion rate or discharge if hypotension or bradycardia occur. We are now discussing beta blocker class 2 because we have studied in angina and hypertension. So the next is Dronidrone, Multec brand. Sotalol, known selective beta blockers. Betapase. So okay, what okay, betapase, sotilide, sorin, dofetilide, ticosin, ibutylide, corvette. So these are the class 3 potassium blockers. Additive QT prolongation, caution with negative inotropes, correct electrolyte imbalance, do not use with grapefruit or ephedra or estrogen woods. ADRs. Dronidrone, QT prolong, serum creatinine increase, and bradycardia, and VD. And sotalol, which is non-selective beta blocker, bradycardia, palpitation, chest pain, dizziness, fatigue. Abdulide can cause ventricular tachycardia, QT prolongation, and hypotension. So mostly if the hypotension is the result, then there is a reason behind is QT prolongation. Dronidrone, warning increase risk of death in heart fail or atrial fibrillation patient. You won't use Dronidrone in heart fail or atrial fibrillation patient. Sotalol, adjust dose with creatinine clearance. QT prolongation is directly related to concentration of sotalol. Abutylide, fatal arrhythmia. Not used. So contraindication, Dronidrone we aren't used in pregnancy. Sotalol, 6-sinus syndrome, second and third heart block, bradycardia, cardiogenic shock. Abutylide QT syndrome में यूज़ नहीं करेंगे. So notes. Dronidrone avoid. Okay. So Dronidrone avoid CYP3A4 or drugs that QT prolong. Take with food. Sotalol, creatinine clearance 40 to 60 must decrease frequency. If your creatinine clearance 40 to 60 से के दरमियान है, you must decrease their frequency to use. Dofetilide only used in hospital. Ibutylide monitor ECG, blood pressure, and heart rate. So class 4 is known dihydropyridine, CCB, calcium channel blocker, slow ventricular rate. Diltiazem and verapamil are the choice of drug. Diltiazem available with cardizem, verapamil, Kelan, Covira, and Veralan. ADRs, edema, hypertension, dizziness, hypertension, arrhythmias, heart failure, constipation with verapamil, gingival hyperplasia. Only known DHP CCB are used as anti-arrhythmiatic. हम DHP नहीं यूज करते, सिर्फ नॉन DHP की बात हो रही है. So another drugs like adenosine, which are available with adenocard, restore NSR in PSVT, post ventricular tachycardia patient. ADRs is arrhythmia, facial flushing, contraindication second third heart block, bradycardia or SSS condition, 6 sinus syndrome. Digoxin is Digitec, Digox and Lanoxin, which is available. Mechanism of action is AV node suppression, enhanced vehicle tone. ADR dizziness, NVD, HA mental disturbance, which so digoxin bonding second and third heart block can cause potassium, magnesium decrease, calcium increase, toxicity increase. Ventricular fibrillation, in contraindication in ventricular fibrillation. Note, range TX range is 0.8 to 2.0, तो therapeutic range है वो इसकी है 0.28 से 2.0. Toxicity, NV loss appetite, bradycardia, not in first line, ineffective during exercise. Antidote is Digifab. Antidote is Digifab. Please remind it. So this most important information about arrhythmias which I can cover with you guys. So if you like this video and you want me to make more videos and more episodes about any other drugs, please subscribe my channel and also to mention your thoughts and suggestions in comments, which is very important for me and keep me motivated to make more videos. And thank you. Allah Hafiz, until next time.